And if everyone would like to mute themselves, we'll go ahead and get started. And I would love to introduce our speakers. My name is Susan Fernbach, and I welcome you all to this topic of what to do if you suspect your child has a genetic condition. I am the co-director for the Office of Community Engagement and Diversity at Baylor College of Medicine and Texas Children's Hospital. And this series is possible thanks to our collaboration with the UT Texas Center for Disability Studies and with funding thanks to the Texas Department of State Health Services. We have a whole listing of recorded webinars on our website, and we hope that if there are other topics you're interested in, that you will go to our website that you see there in the chat. This is a Zoom meeting, so we just ask that everyone mute their microphones, and then we will save time at the end for questions and answers. We really extend a warm welcome to each of you, and hope that if you are interested in listening in Spanish, that you go to the language channel at the bottom of the screen and click on the Spanish language. Si quiere oír esta presentación en español, Margarita Gibler nos conoce. Yes, and for the questions as well. So I really thank you all very much.
There's a question in the chat about, will the presentation slides be sent out?
I will discuss that with the speakers. We are recording this, so we will have the presentation available online for viewing, and we'll send a note out afterwards to everyone who's attending for sure. So this topic really was at the suggestion of parents. When we did surveys, they were very interested in learning what to do if their child has a genetic condition. So today we have 3 expert speakers, and I'm really thrilled to introduce each of them to you. I will introduce them in the order that they will be speaking, and we do want your questions at the end, and you're welcome to either raise your hand and unmute or type your questions into the chat, and we will try to get an answer to all of them. Our first speaker will be Dr. Kevin Glinton. He is a pediatric geneticist at Texas Children's Hospital in Houston, Texas, and also an assistant professor in the Department of Molecular and Human Genetics at Baylor College of Medicine. Dr. Glinton received his PhD from the University of Southern California and his medical degree from the Geisel School of Medicine at Dartmouth Medical School. He received his pediatrics residency training at the University of Virginia Medical Center, followed by his medical genetics training at and fellowship and biochemical genetics training at Baylor College of Medicine. Dr. Glinton sees children with a variety of genetic disorders, but has a particular interest in the diagnosis and treatment of children with inborn errors of metabolism. And that's also his primary research focus. He's trying to understand and improve the treatment for children with these genetic inborn errors of metabolism. Our second speaker will be Ms. Liz Misrek, who is a genetic counselor at Texas Children's Hospital and at Baylor College of Medicine. Her research interests are in inpatient genetics, health disparities, and monogenic diabetes. Liz provides mentorship, supervision, and education to genetic counseling students, medical students, pediatric residents, and genetics fellows, along with other learners in the community. She actively collaborates with researchers who are identifying and describing new rare diseases. And our third speaker will be Ms. Laura Buckner. Ms. Buckner is a licensed professional counselor and former special educator with a master's in education. Laura's areas of expertise include person-centered practices, leadership and advocacy, trauma-informed care, and supporting families and individuals with intellectual and developmental disabilities to live lives they find meaningful with access to the necessary supports and services. And Laura is the founding partner of the Institute for Person-Centered Practices and a mentor trainer with the Learning Community for Person-Centered Practices, where she also serves on the board of directors. Laura is the devoted wife to Ron and the mother of 2 sons, Michael and David. So from your homes, please give a warm welcome to our speakers. And I will turn it over to Dr. Kevin Glinton. And Dr. Glinton, you can share your slides as well.
All right, thank you so much. Let's see, share screen. All right, can everybody see that? Perfect.
Yes.
All right. So thank you, Susan, and thank you all the organizers for having me today. And I thought for my portion of this session, I would talk about, what are the signs your child may have a genetic disease? What are the things doctors look for when they decide whether or not a child gets referred to a geneticist? And what actually happens when you see a genetics doctor for the first or second time? So what are genetic disorders? I think it's important for us to, be able to say what these actually are. And genetic disorders are really diseases caused by changes in a person's DNA, away from what we think of as sort of the normal sequence. So, most of us think that genetic disorders are rare, but they actually affect about 2 to 14% of children in the US. And I think most of us also think that these always have to be something very severe or life-threatening, but genetic disorders really vary widely in terms of the severity that we see. Sometimes you just see one specific symptom or effect. Other times, a small symptom can be a sign of something larger that may require additional procedures, surgical interventions, or even other specialists that we would recommend that you follow up with. So as I mentioned, genetic disorders are changes away from the normal genetic sequence of an individual. And so recall that our genetic information is made up of our genetic code, which are kind of nucleotides that we use letters to say what, to note which each one means. And so I like to tell my patients those letters line up in a sequence, just like you see a sequence in a book or an instruction manual. So in our bodies, those sequences are organized into chromosomes, and we each have 46 chromosomes in all of the cells in our body. And so just like if you're reading a book, you can have mistakes that happen in many different mechanisms. You can have an abnormal number of chromosomes, so missing chromosomes or extra chromosomes in some of the cells or all of the cells in your body. You can have minor spelling mistakes in the genetic information that have larger outsized effects. You can have mutations due to multiple genes, and that's what we call sort of multifactorial disorders. And you can also have complex medical diseases where you have some mutations, but you also have influences on the person due to environmental factors or exposures. So when doctors think about, does a child have genetic disorders, that can really start any time during that child's lifespan. We do see with some frequency concerns for genetic disorder prenatally. So a mother may have abnormal prenatal screening, so-called NIPT or non-invasive pregnancy testing or pregnancy screening, or abnormal quad screening. The doctors can see abnormalities on ultrasound, and those can actually give us a sense of a possible underlying genetic disorder. Things like the child or the infant being small or measuring small in ultrasound, or having abnormal anatomical features in the womb. So heart malformations of the kidney or the intestinal tract. And there can also just be smaller signs that may clue doctors into there being a possible genetic problem, like having a single umbilical artery or some minor brain abnormalities. Prenatally, doctors may also be concerned for a genetic disorder based upon a mom or dad's family history that they know going into a pregnancy. A lot of times, however, we get most concerned when the child actually is born, so what we see. And a lot of the admissions or consultations we get in the hospital are for newborns who come out of the womb with some sort of malformation or some abnormality that the doctors are concerned may point to a genetic diagnosis. So that can be things like having congenital heart disease or major malformations like a cleft lip or a cleft palate, having missing digits or extra digits, Certain strange birthmarks can actually be very indicative of a genetic disorder. And you can also have abnormal newborn screening that happens through the state that comes back with signs of inborn errors in metabolism, like what I study. As a child grows, there are other things that clue us into a possible genetic disorder. Things like developmental delays and learning disabilities. This is kind of the bulk of what we see, in our school-age children in our clinic. Signs of autism spectrum disorder. Most people don't realize that there is a large portion of autism spectrum disorder cases that are actually due to genetic etiologies. We also see many children for poor growth, and that can be poor weight gain, but also short stature. So children measuring shorter than we'd expect for their genetic potential, meaning based on their family history or their parents' heights. Another very common disorder that we should all think about having a genetic evaluation for is hearing loss. We know that about 50% of hearing loss has a true genetic etiology that we can diagnose and identify. I like to also say that genetic disorders should be suspected in any of these sort of unusual childhood conditions. These are conditions that we tend to think of are fairly common, but actually do have, now we realize, more and more of a genetic cause behind them. So this can be things like seizures. We know that a lot of seizures have a genetic basis, kidney disease, liver disease, certain types of childhood cancers, not all, but certain types of childhood cancers can be very indicative of a genetic disorder. Arrhythmias or heart rhythm issues can often have a genetic basis, and sort of bone abnormalities or bony malformations, similar to what we see prenatally or kind of immediately postnatally. So missing digits, abnormalities of the digits or of the limbs. So when your doctor sees any signs of these kinds of conditions in your child, or when you observe any kinds of these conditions in your child, it's often recommended and we encourage you to be evaluated by a medical geneticist. And most people don't realize what medical geneticists are and who we are, what we do, but we are medical doctors who all have some advanced training in human genetics. Most of us, including myself, have completed training in pediatrics, but a lot of other medical geneticists have advanced training in internal medicine, OBGYN, neurology, sometimes ophthalmology, neonatology, etc. A lot of us also do some form of research as well as our clinical work. And that's because genetics is one of those fields that is constantly growing, evolving, and moving forward to kind of make better diagnoses and find better tests for patients. Overall, however, the medical geneticist is in charge of your evaluation and formulating testing plans based upon the history that you report and sort of the clinical signs that we see in your child. So during the visit, it will involve, as you would imagine, a lot of us gathering extensive history on the things that have been concerning to you and your family and your pediatrician, but also other things that you may not think have a sort of genetic importance to them. So we will discuss a lot about your pregnancy and the baby's birth history, things like what age the parents were at conception or any complications during the pregnancy, any tests you had during your pregnancy or what kind of delivery you had, was there complications during your delivery. We will talk a lot about the postnatal course. So we pay a lot of attention to the baby's birth weight, how long they were, how big their head was. We look for, signs of their feeding. What were they feeding? How was their initial feeding when they were born? And then whether or not your baby required an admission to the ICU nursery or regular newborn nursery, and any sort of infections or complications during their time in the hospital. And then we'll talk a lot as the baby grew up, any sort of signs or symptoms that you or your pediatrician had that your child may have something abnormal going on. We'll discuss at length the child's developmental milestones. So the age at which they walked, started talking, started, undressing and dressing, all those different things. And then whether or not your child needed to have hospital admissions or surgeries, anything out of the normal for a child at that age. And we also discuss, does the child require any special services, therapies, or other subspecialists the child may see? The sort of core bulk of what we do in genetics is looking at the influences of family history. So we will spend a significant portion of the visit discussing your family history and drawing out a family tree or a pedigree, as you see on the right. We will ask about first, second, third, sometimes fourth degree relatives. So we always ask patients to kind of go back and ask family members, how many children do my uncle and aunt have, or what conditions did my grandparents have, so that we just kind of have an idea what the family background is like, and if there are certain medical conditions that are traveling in the family that may clue us into what's affecting your child. We will also ask for the family's background or ancestry. This plays a lot into certain diseases that we know have more or less prevalence in certain populations. And then we'll ask, is there any consanguinity, meaning is there any chance the families could be related, or that you have any identity by descent, which happens when parents are from, both from a small community or from a certain small area of a country. We will then perform a full physical examination where we, just like your regular pediatrician visit, listen to the child's heart, lungs, bellies, look at their hands, feet, eyes, etc. But we'll also perform, what's particular to genetics, what we call a dysmorphology examination. And that's a very careful exam of their child's features. And in that, we're looking for anything abnormal or atypical that may clue us into a specific diagnosis or syndrome. You may see a geneticist pull out a measuring tape and measure certain very fine features on your child, like how far apart their eyes are, how big their ears are, how long their fingers are. This can seem a little bit disconcerting to parents, and it's not so much that we don't think your child is beautiful, it's more so that we're trying to find any small, feature that may clue us into one diagnosis versus the other. Sometimes we'll even request to see pictures of the other family members. So we'll request to see pictures, if mom came alone, of the father of the child, or mothers, brothers, and sisters, to see if there are features that are running in the family or features that are different in the child when compared to the rest of the family. A lot of these things may seem sort of intrusive, and I always joke that geneticists are some of the most nosy doctors out there, but it really is meant for us to get a full sense of your child's features so that we can really make a very clear and informed decision about their testing moving forward. So what about that testing? Well, your provider will decide on what tests they think are appropriate based upon your clinical suspicion, the child's physical exam and history, and other things that you report that we think may or may not be important in determining the test that we decide to do. Genetic testing can be expensive, so we often will need to obtain insurance pre-authorization first before we go ahead with testing. Although nowadays, especially at our clinic, we are able to do some testing on the same day based upon the type of insurance that your child may or may not have. A lot of us think that the testing has to be blood, but we've moved sort of away from that as sort of our default testing method now. We often recommend, or we often utilize today, what we call buccal swabs. And these are what you see on the picture on the bottom right, where you obtain just a brushing of skin cells from the inside of a patient's mouth. Sometimes we will still do blood samples, and other times we may do saliva samples as well if we have a child that's old enough to give us a reliable saliva sample. So we have lots of different options instead of just blood like we used to have a couple years ago even. And so one of the questions I'd like to finish up on, and one of the things that a lot of patients ask us is, well, why is testing important? Why should we do this? Is this going to change things, or how is it going to be helpful? And I always say you want to test for several different reasons. Number one, testing allows for us to get an accurate diagnosis for your child that can better inform disease-appropriate treatment moving forward. What do I mean by that? We know, for example, a child has a specific genetic condition. That allows us to tailor your child's treatment to the symptoms or complications we know are going to be important, need to be addressed for that condition. But it also helps us to rule out other diagnoses and reduce the need for other unnecessary tests or interventions that your child may be receiving, but that may not be pertinent to their actual condition. A diagnosis may also help us determine, what other further testing or therapies or subspecialists your child may need to be referred to. If we know, for example, a disorder, may lead to a risk for developmental delays, we would encourage a family then to be more proactive with getting the child services and therapies before they have signs of delay so that we can maximize their development moving forward. I also like to say that an accurate diagnosis helps us with discussing the inheritance of that disease and also informing the risks that we can quote to you for other family members. What do I mean by that? Well, that means, if a child has a genetic disorder, and we know how it's inherited, we can have really clear discussions with the family about the risk to that child's siblings from having the same disorder, to the parents, if they would have signs of that disorder, and then their family members. So the child's cousins, aunts, uncles, what are the risks that they may be affected, even though they may not have symptoms right at this moment? There's a lot of different reasons that we say to do testing beyond just, for us to know. And I think even in cases where we can't find something treatable, it's still helpful in that it can provide answers to the question of, why did this happen to my child? Did I do anything wrong that could have led to it? We often have to tell parents that, for genetic disorders, this is not your fault. You can't control what genes you pass down to your child. And, the biggest thing you can do is to help your child to get to a diagnosis and help them move forward from a diagnosis. So with that, I will leave it to Liz to take over kind of what we do with this test once we get the results.
All right, well, thank you so much, Dr. Glinton, and thank you to the organizers for allowing me to speak to you all today. All right. Can you guys see my slides? Okay, perfect. So you had the genetics evaluation now, kind of where do you go from there? And so I'm going to first talk about how after a diagnosis is made. I think we end up having a longer conversation and talk about a lot of different things during the follow-up counseling session. So the couple first things that we talk about is the prognosis. So does this change your child's life expectancy or trajectory? Is this something that's progressive where we would expect more symptoms to happen, or is it stable where kind of where your child's at now, we would expect that your child to kind of stay at that level? And this varies by genetic condition. So there are thousands and thousands of genetic conditions. And so some of these are more important and we have a longer conversation about with certain genetic conditions, and others, like Dr. Glinton said, they may not have a long list of symptoms. You may just have one symptom. And so depending on the diagnosis, we may talk more or less about the certain topics that I'm reviewing with you guys. And so in terms of management, so did the diagnosis change anything that we need to do for your child? So are there extra imaging? Do we need to look at the child's kidneys or brain or heart based off of the diagnosis? Are there any medicines or therapies like physical therapy, speech therapy? Are there any specialists? So do we need to refer your child to neurology or the eye doctors, or just any there? Again, like based off of the genetic condition, it'll be tailored towards based off of that condition, what we think what referrals need to be done. And then regular follow-up with genetics. So I think that's one thing that's really important, is on a yearly basis or every other year, having an appointment with the geneticist, because they can help, okay, now that my child's 1 year old, what do we need to be thinking about? At 2 years old, what do we need to be thinking about? And kind of can help you guide so you don't feel overwhelmed having to remember every little step, but every year checking in and helping and allowing them to say, what needs to be done now, and allowing them to help you through that process. And anticipatory guidance. So we may get a genetic result that, for example, may increase the chance for seizures as your child gets older. The condition may mean that your child may never have seizures, but there's also a chance. And so we would talk more about, these are the possibilities. And so if there were any symptoms of your child having a seizure, that would be something important for you to know, to bring that up to the doctors in the future. If there, like Dr. Glinton had mentioned, any childhood tumors that we find and we get a diagnosis, are there other types of tumors or cancers that we should be screening for and giving that guidance? And then inheritance. So like Dr. Glinton had mentioned, there are many different ways you can have a genetic condition. And so we have 46 chromosomes, 23 come from one parent, 23 come from another parent. And so depending on the inheritance, whether or not one of those chromosomes has the change or both of them depends on how we would think about recurrence risk. So, or what are the chances of having another child with that same genetic condition? Or what are the chances that any first degree relatives need to be tested? So first degree relatives would be siblings, children, and parents. And so that's similar to what I was just mentioning about cascade family testing. So this can also be very overwhelming to think about. And, you know, how do I remember all of this information from this appointment and then try to disseminate that to my family members? And often the genetics clinic will write a family letter that states, you know, we have made this diagnosis and your family, all first degree relatives should consider genetic testing and how to do that. So with information on how to find a genetics provider near other family members and what testing specifically needs to be done to help facilitate that. And we also provide resources. So again, depending on the genetic condition, so we will provide just general genetics resources on inheritance and things like that. There are typically syndrome-specific or genetic condition-specific resources as well, and then different support organizations. And I think sometimes what's difficult is sometimes getting a diagnosis can be very overwhelming. And, you know, when we go to ask the families, you know, what questions do you have? It's kind of, sometimes families don't know what to ask or don't know how to ask. And so these are some of the common questions that if a family is kind of thinking, I have no idea where to start, I will start to, you know, say, well, some families have these types of questions. And then that helps open that conversation for the families to ask more questions. But some of the things, you know, is there a cure? Can this genetic change be reversed? And more often than not, the answer is no, but there are treatments for some genetic conditions that can help manage the symptoms. You know, will my child be able to go to school? So, you know, when we think about a genetic diagnosis, sometimes we may see developmental delays or where a child it may take them longer to walk or talk, for example. But that still means their child can go to school and, you know, participate. And while, you know, a child may need extra help in school, they still get to go make friends, be there, play on the playground with everyone. And so I think one of the main things I try to make sure that families know is that this doesn't, a genetic diagnosis doesn't define a child. And so we know more about your child when we have a genetic diagnosis, but it is not the main part of your child. And, you know, every child is going to have their own personality and likes and dislikes and not going to want to eat their broccoli when they're told, right? And that has nothing to do with the genetic diagnosis. And so one of the main things I try to make sure the families know is like this isn't, you know, we're talking a lot about this diagnosis, but it's only a small part of who your child is. And, you know, what happens now? How do I figure everything out? And so again, laying a roadmap for families to try to help guide them. And majority of the time, everything has already been done. And so because of different symptoms that we may see before the testing, majority of the time I can tell the families, you're already doing everything you need to do right now. So we'll follow. And so once they get a little bit older, there may be other things we need to do, but you're doing everything for your child that you need to be doing. And sometimes we get a result where there is a hereditary cancer syndrome, and families may want to know, will my kids develop cancer? And So having a diagnosis of a hereditary cancer syndrome increases the chance for developing cancer, but doesn't mean that your child will develop cancer. And so sometimes it's important to have that information for screening to help reduce the chances of developing a cancer. And again, I'm so glad Dr. Glinton had mentioned this, because we get this often, was there something I did that caused this? And the answer is no, because we don't get to choose what we pass down. Sometimes we don't know if we're a carrier for a genetic syndrome or genetic condition until we have a baby who has symptoms. And so there's truly no way to know ahead of time. And there's nothing you could have eaten or not eaten or slept a certain way or anything like that during the pregnancy to have caused your baby to have a genetic condition. And so what resources do we give? And I want to give enough time for questions, and I'm so glad this is being recorded. So I'll kind of go through this somewhat quickly, but you will have all of this to go back to in the future. So Google can be your friend and your enemy. So it's helpful to find websites that use the .org, .gov, or .edu. Sometimes for the more rare conditions, we're still learning. So if there are only 10 children that have this specific condition, there might be very limited information. And oftentimes with a genetic condition, there's a spectrum of severity. So some children may be very mildly affected, have very few symptoms, but then other families or other children may have much more symptoms. And so sometimes it can be hard to go online and see a child that doesn't necessarily match with what your child is experiencing, but just keeping in mind that there is a spectrum. And so, if you have any questions, if you read something online that scares you or concerns you, it's really important to go back to your genetics provider and ask them, hey, I read about this online. Is this something I need to be worried about for my child? And the same thing with Facebook groups. So there are some very good community Facebook groups, but sometimes they can also be scary or overwhelming. And so keeping that in mind that not every child with the same exact genetic condition is going to have the same challenges or victories. And so keeping that in mind that I'm so thankful we have, online support, but also, keep in mind with everything with a grain of salt that sometimes other people's experiences may not be the same. But again, always go back to your genetics provider and say, this is what I read, or this is what I saw. What do you think about this? What is this something I should be worried about? So the Mountain States Regional Genetics Network has a lot of really good information, and this is a list of different things that they have on their resources page. So most of these resources are very related to more general genetics that I'm going to go through. But you can also find, like, when you meet with your genetics provider after you have a diagnosis, they will be able to go through with you different syndrome or condition specific resources. NORD, or the National Organization for Rare Diseases, they also have many great resources for patients and families. Global Genes is also a great resource, and Global Genes specifically is very good at trying to connect people who have ultra rare conditions. So conditions where there may be only 10 to 20 children affected. They have ways of trying to help connect families. They also have different resources on advocacy. So how do I create a support group for my child who has this condition? How do I advocate for drug trials? And so there are a lot of really good resources if you want to start to become more active in the genetics community with advocacy. Medline Plus, which used to be Genetics Home Reference, is another good resource. And this is something that we use quite often. They typically have a good 1 to 2 page summary of most of the genetic conditions. And so this is something that we'll often start with to give to families, and as a good way to kind of introduce them to this diagnosis. Texas Parent to Parent is also a good support website, connecting families in the Texas network that may have a child with, and not necessarily just a genetic condition, but also children who may have a disability. And there are different conferences. And now that, hopefully the pandemic is lifting, those are happening more often. But another great resource. The Genetic Support Foundation is another resource for general genetics learning. So they talk about inheritance patterns, family history, types of genetic testing, and when it could be helpful. And unique or rare chromo. So if your child had a chromosomal condition, they also have some gene diagnoses on their website as well. They have very helpful guides in many different languages that can help you kind of understand that diagnosis. So we've talked about, if we've done all the testing and had a diagnosis, sometimes and not uncommonly, sometimes we will get a child who we suspect has a genetic condition, but we haven't been able to find an answer. And so there are some avenues for children who, where we might still be seeking a genetic diagnosis to help with treatment and management. So the Undiagnosed Diseases Network is a program where, we can enroll or apply to enroll your child to try to determine if we can find a genetic answer through research methods. And clinical trials. So there are many clinical trials as well, depending on different symptoms that your child may have. And there may be other research studies or registries that we could find to help enroll your child in to see if we can find a diagnosis. So how to find a genetics clinic. So again, I'm so glad this is recorded. So again, you all will have access to this. And I put QR codes there on each of these pages. So if you guys wanted to navigate to each of these pages. So there are ways to find a genetic counselor. Find a genetic counselor is the website. And there are in-person and telehealth options. I will say for most genetics clinics, I would imagine we're still doing kind of a hybrid of some in-person and some telehealth. And I think that's one positive thing from the pandemic is that we are available to have those telemedicine appointments more to allow for access to families who can't take off work or may not have transportation to travel far to a genetics appointment. So ACMG, or the American College of Genetics, or Medical Genetics, they also have a website to look for genetics clinics throughout the US and Puerto Rico. So this is another good resource. The Mountain States Regional Genetics Network, they also have a good resource of listings of their regional area of all of their clinics. And then the Texas Department of State Health Services also has some resources on how to find a genetics clinic as well. All right. And with that, I want to say thank you very much for having me, and I will turn it over to Laura.
Thank you so much. And let me get my PowerPoint up real quick. Let's see, I've got to share my screen. There we go. Can you see that? Yes? Okay, great. So I want to talk about what happens after you find out there's a genetic condition and possible disability. And I've lived this. My son, who is 32 and a half years old, was diagnosed when he was 3 months old with a disease I'd never heard of before. And 32 years ago, they didn't know as much as they know now. They couldn't tell us if we carried the gene or not. I'm happy to say that we were able to participate in the study that identified not just one gene, but two that can cause a disease. And then we learned that we don't carry the gene. So we had a sporadic mutation, they called that. And so, what I know is that after you have gone this route, seen the geneticist, had a genetic workup, and you find out there's a genetic condition and even possible disability, you still have to go home and live a life. You still have to go home and parent a child. And so I want to talk about that just briefly. Sometimes that's a expected possibility you may have gone into. You may have found out prenatally and gone into parenthood knowing that this might be the situation, but often it's a total out of the blue. It was for us, totally out of the blue, a shock. And the baby pregnancy books don't prepare families for this. You can read them all day long. They don't tell you how to deal with some of this stuff. So I want to talk about some important next steps for those of us who all of a sudden get hit with something we weren't expecting or weren't completely prepared for as new parents. The first thing I want to remind everyone is that the disability label, the genetic condition, is only a medical diagnosis. A lot of times families get inundated with a lot of medical information at the point of diagnosis. And, for us, it was with a 3-month-old baby. And we all of a sudden are inundated with therapists and medical professionals and a lot of helping profession people, don't get me wrong, but we as families, we get so inundated with that world and that language about our child that we start talking like those people. We start identifying our children like the medical professionals do, and we forget we still have a kid here that's just a child. And so, I meet people all the time who want to have cards to hand out at the grocery store. My child has this condition, read more about it here. And I know they intend to educate people, but I always say, don't educate the world at the expense of your child, at the expense of your child's own identity. And so it's just a medical condition. So think of it as a passport to services. We all know what a passport is. And if we wanted to leave the United States and go to another country, we would need a passport to get into that other country. We'd sure need a passport to be able to get back into the United States. But we don't pull out our passport every time we want to go to another city or we cross a state line, right? We just pull out the passport when we need it. So that medical diagnosis, that disability label, I want you to think of it as a passport to services. The only time you need it is when you're trying to open the door to a service. Perhaps you're trying to open the door to a specific genetic clinic, or you're trying to open the door to special education services or early childhood intervention services or Medicaid services or some type of therapy. There are times that you need that label to open that door. And that's when you pull your passport out of your back pocket. But you don't need it at the grocery store, in the Walmart, and at the park. Just pull it out when you need it. So a lot of this for families is altering our own mind, our own mindset about disability, about genetic disease, about medical issues. What is your attitude toward that? Because the attitude you have is going to influence your child's attitude about him or herself. And it's going to influence the attitudes of people around your family and your child. My son was diagnosed when he was 3 months old by a brilliant pediatric neurologist who also happened to be a psychologist. And he said these words to us the night he diagnosed our son. And we had a pretty grim prognosis. I'll just tell you, it was not a happy day. It was a scary day. But he said, this child will be as disabled as you choose to see him. those were words I've never forgotten, because what he was telling us is you have power in this. If you see this kid as totally disabled, that's what he'll be. And he was right. So I tell experts, be sure you're providing knowledgeable, up-to-date, reliable, accessible resources. And if they aren't those things, if your resources that you're handing out don't hit all those bullets, don't give them out to people. I remember our neurologist, the night he diagnosed my son, saying, he handed me some things, some written material, because we didn't have the internet 32 years ago. He handed me some written material written by a doctor who was well known in the research and study and treatment of my son's disease. And he said, I don't want you to read anything unless it's by this doctor or this doctor. He named the two doctors. Just a few weeks after my son's diagnosis, our pediatrician, who had gotten word of the diagnosis, and I know was completely well-intentioned, sent me some material in the mail that he had gotten out of a March of Dimes book. But it was unfortunately out of date. I started reading what he had sent me, and I was horrified. I was scared to death. And then all of a sudden I looked to see who had written it. And I saw that neither of those two doctors that my neurologist had named had been a part of the writing. And I realized it was out of date. It wasn't accurate information. And I put it away. I quit reading it. I threw it away. And I was very careful from that point on to only read stuff that was given to me by people really knowledgeable about my son's disease. And so Facebook, and I was glad you said that, Liz, Facebook and Google can be wonderful resources, but they can also be disastrous in terms of misinformation and scaring people unnecessarily. So I'm glad you mentioned Parent to Parent, because I want to talk to you about some connections to be made. Parent to Parent is an excellent statewide organization that offers regional conferences as well as a big statewide conference. And this year, the last couple of years, they've had to do their statewide conference virtually because of the pandemic. But this year, they're doing it live in Austin, I think. Don't quote me on that. It is in Austin, I think. And we're doing one in El Paso in just a couple of weeks, about a week and a half. So if you're interested, look up Texas Parent to Parent. And they can connect you. Not only are they a good resource for knowledge and connections, but they can connect. They have families who are trained as parent connections. So I could call and say, I have a child with this diagnosis and he's this old. Do you have anybody that I could talk to? And they will connect you to a parent that they've trained to talk with you, who has a similar situation, similar age, etc. Another really important website that I encourage people to look at is Texas Project First. It's all spelled out, texasprojectfirst.org. And I put on here the link, but they have age ranges. So if you're talking, for example, to a parent whose child is just being diagnosed between the ages of 0 and 3 years, then you would click the 0 to 3 age range button. But they have age ranges going all the way up to adulthood. And they'll have very good specific information for people receiving special education services. The website is funded by the Texas Education Agency, but and it's vetted by the Texas Education Agency. So you know that anything that's on that website, TEA, Texas Education Agency, approves of and validates. Sometimes you can go on the Google and find special ed information and you think, this is really helpful. And you go to an ARD meeting, an IEP meeting, and you find out that, well, that doesn't apply to Texas. TEA funds this website specifically so families have Texas Education Agency specific information. You can pull something off that website and take it to your IEP meeting and know that it's accurate. And the last thing I want to talk about is Medicaid waivers. If you think a child might need assistance as they get older, in terms of respite care, attendant care, home living modifications, nursing assistance, therapies, etc. You need to get them on the Medicaid waiver wait list. The state calls them an interest list, but I call them a wait list because it's, unfortunately, we have over 100,000 people in the state of Texas currently on the interest lists in Texas for Medicaid waivers. There's a variety of Medicaid waivers. It depends on what your needs are and how you might qualify. Navigate Life Texas is an excellent website that has a really good page where they explain what Texas waivers are in parent-friendly language. Because I'm sorry, go to the Health and Human Services website, and it's just a little daunting. It's hard as a family member new to this information. It's a little hard to navigate. But Navigate Life Texas makes it easier to understand and figure out what waiver you might need to sign up for, or why you want to sign up for one. I meet families with very new babies, and I'll say, I want you to call this number and get your name on the wait list. Because here's the thing, you might be on the list. Our typical wait right now is 12 to 18 years. My son came off an interest list in January that he'd been on for 16 years. 16 years we were on that list. So you want to start families on it early and just tell them you don't have to even understand what it is completely, because you don't have to qualify to get on the interest list. All you have to do is say, I want to be on the interest list. Once your name comes up on that list, then you have to qualify with IQ testing or some form of diagnosis, depending on what the waiver is. But you don't have to qualify until your name comes up, and you don't want to wait until that child is 15 or 16 years old and people start realizing he's going to need some adult support. It's too late by then to get them on. It's not too late. It's never too late, but you're behind the eight ball. Know that families do not have to qualify for services. They don't have to even know what the services that they are going to need will be. You don't have to know. I mean, I signed my son up at 16. I didn't know what he was going to look like at 32. But he needed the support. When he came off the list, I knew what he needed. I suggest that if you're giving parents information about Medicaid waivers, give it to them in writing, because it's daunting information and they're already overwhelmed with way more information than they know what to do with. I even suggest that you get a loved one to help make those phone calls so it doesn't get lost in the midst of everything else. Or if you're a service coordinator or some kind of helping profession, make the call with them. Just make the call with them, because it only takes 5 minutes. And then remind them that they have to update that information annually, especially if their mailing address changes. Because if you have your child on a wait list and then you move to a new address and Health and Human Services doesn't know about it, your name could come off that list and they won't know how to get in touch with you, and you will lose that slot. Do have a clear conversation with families about the financial restrictions involved in Medicaid waivers and Social Security benefits, because a lot of families, well-meaning, I did it, the baby's born and you want to set up a college fund or you want to set up a savings account or whatever. In order to qualify for Social Security benefits or Medicaid waivers, the child can never have more than $2,000 in his or her name. So I advise families very early on, don't put anything in their name. Just heartbreaking, but it's the truth. But remember that nobody has a crystal ball. I always tell families, the expert's job, the doctor's job, the geneticist's job, their job is to paint the possible picture. And that might be grim. They have to paint all of the picture that could be to prepare you for that, because they can't just paint a rose-colored, with rose-colored glasses picture and then it not turn out to be true. They have to tell you what can be. But your job as a family member is to have hope and to have expertise on who this child is outside of or in addition to the genetic condition and the disability. The genetic condition or disability is just one piece of the puzzle. Who is this kid? What do you love about them? What are they good at? What do they love to do? Those are the things that make for a meaningful life. So help families become those experts. And I'm going to close, I'll tell you that this will be in your handout. There's a website that tells you how to do a one-page description for your loved one. And I'm going to close there with just being sure that you cultivate hope. You know, when you get a scary diagnosis, a lot of times it takes hope with it. And children need hope in order to grow, so do families. I'll close with that. Thank you.